not typically agreed a lot with Commissioner Rothman, but he recently described our situation as the individual market is on the verge of collapse. And I agree. I think he's right. In the last 3.5 years since we've seen the implementation of MNSure, our insurance marketplace has been devastated. It's been devastated by policies driven by an ideology that Governor Dayton and the Democrat majority in the Senate have embraced. And these policies have caused harm to untold thousands of people across the state of Minnesota. People have lost their insurance. Premiums have skyrocketed. In some cases, people have lost their lives as a result of the kind of catastrophic failures that this so-called marketplace has created. It's cost millions of dollars, millions of taxpayer dollars, and it hasn't solved any problem. When all this was being constructed, Republicans, many of them here with me today, offered ideas to try to make this work better. Every idea was rejected. Every Republican idea was rejected by the Democrats, who were in complete control of the legislature and the governor's office at that time. They said, we've got to figure it out. We don't need your help. This was an extremely partisan, ideologically driven solution, and it hasn't worked. And we're not hearing anything from the Democrats and the governors that we should reconvene a task force. Republicans have ideas. We've had ideas from the beginning. We've offered those ideas, and we are prepared in a majority next year to implement those ideas. So we have some examples of policies that are in the handout we've given. I'm going to ask some of my colleagues to talk a little bit about some of these legislative ideas that we think will work, that will make things better, that will improve, will cause premiums to go down, will rejuvenate the individual marketplace. All the things that we've seen happen are broken promises. Remember the promises. Healthcare premiums were going to go down. You get to keep your doctor if you like your doctor. You get to keep your plan if you like your plan. None of those things are true. And all I would say is if you don't like your plan today, you can blame a Democrat majority for that. So I'd like to turn over to my colleagues and let them offer a few of the ideas that we have talked about and that we plan to introduce next year and pass with the Republican majority.
Good morning. And as Minnesotans know, whenever MNSure comes up, whenever the ACA comes up, the Democrats are either silent or they defend the status quo. No matter how many ideas are brought forward, they are soundly rejected in the name of partisan politics. We're here today with sincere hearts and hope that as the next legislative session convenes, we can focus on Minnesotans with real solutions. Our Main Street businesses can't take this anymore. So a few of our ideas: let's lower premiums and deductibles. Many of you remember MNGOP, the risk pool. It probably needs to come back in a modified version, but how reasonable to bring back something that was working in Minnesota and move that idea forward as a real solution for Minnesota families. How about tax deductibility for health insurance premiums? Employers can deduct the insurance that they provide to their employees. So why can't an individual starting a business deduct their insurance? Or a family who has to go into the individual market deduct their insurance from their taxes? These are really solid ideas that are worthy of debate, that have been shut out for the last 4 years in the conversation about healthcare. And we are proud to bring ideas forward that serve the people of Minnesota.
I am Senator Jim Abeler. I'm really happy to be standing here as part of the debate. I've been part of this debate all the way along. We sat here in 2013. I was part of the crew celebrating the possibilities of what MNSure could be. The Expedia of healthcare, and costs were going to be so affordable, and the benefits were going to be amazing. And I cautioned people then, you better be careful about the details. It doesn't want to ruin the market. If you're following along, I'm going to discuss the top of page 2 with more choices. We were excited about more options. I thought Minnesota could design a great plan. And as it turned out, only one side listened. And they didn't take my advice, they didn't consider Benson's advice, or any of the other advices that were offered up here. In fact, they rejected point blank almost every idea we brought forward to make it work. And so now we have just extremely limited amount of choices. And so now it's time to think what to do next. And by the way, if you're a firefighter, you pay attention to smoke. You think, well, smoke, that's important. And it might just be a small little thing that's causing smoke. But then you see a flame and you go, well, it's only a small flame. And the system here and the partisan divide said, oh, it's just a small flame and don't really worry about it. Well, now the house is almost consumed. And harm is going to happen to the people who are the backbone of our great state. 5%, what does it mean 95%? Statistically, it's insignificant. Those 5% are the people who live and work on Main Street. They live on farms. They have 3 employees, and they have been struggling to find options since this all started. Their premiums are up to $1,200 a month for a $12,000 deductible policy, and they had to get a different doctor, even though they were promised to keep that doctor. Well, now their payments are going up to $22,000 a year, and they can't even have the doctor that they got before they didn't even like very well. Now they hope they can get a plan. And the quotas that are being established are going to deprive those people even of the choice that they could have had. Maybe they can get a plan. Now, Commissioner Rothman, who I count as a friend, and I like him a lot, said, oh, well hurry, get first in line to make sure you can get yours. And we're becoming the Hunger Games of healthcare. This is not Minnesota's excellence. This is not what we've come to appreciate. So now, with the house on fire, we have to look at options that make a lot of sense. And so, what if we allowed employers to move into groups? Some of these associations, what if the Kiwanis could set up a health plan? What if the counties could be allowed to set up a health plan with the county-based purchasing, which, by the way, has the strongest amount of oversight and closeness to the community? And one of the ways to save money these days is by having skinny networks. The way a skinny network saves money with limited doctors is someone doesn't get to go to the doctor, which is not what you pay for. So this poor guy on Main Street who has 3.2 employees and he's barely making it, making 60 grand a year, paying $22,000 a year for his health care now, with a $12,000 deductible, is going to pick a doctor 30 miles away. Great. Congratulations to what we've got going. And so I want to remind people that 5%, that is the backbone of Minnesota. That's the Kiwanis members, it's the Knights of Columbus, it's the people that go to the community events. And we're saying, good luck to you. You get to spend a third of your income on a health care plan that doesn't get you anything you wanted. What success. And so we're here today with real ideas, not to say we told you so, but to say, holy cow, there's a fire. And convening a task force won't work. And I think quotas are illegal. What if there was a quota on people who can get into medical assistance? People would be up in arms, there'd be a march outside of here. But the guy from Anoka who wants to just take care of his family and has his own little business, he has to maybe get lucky to get a plan he doesn't like that well? Horrible. Thank you.
Good morning. I'm State Senator Paul Gazelka from Central Minnesota. And Senator Abeler talked about that 5%. Well, that 5% is my district. That's the farmers, that's the small business owners, that's the people that make my area run. And I find that very offensive that they are so minimized and may not even get coverage. So I was involved from the very beginning taking a look at MNSure for the commerce side. And in commerce, from the very beginning, it was a fiasco. MNSure was a fiasco, but I thought it would get better. I thought perhaps they'll listen to some of our ideas, but they never did. And so here we are today, and we want to reiterate and offer those solutions. And so the area that I want to talk about is how do we make the system more efficient, because we can do that. A couple of the areas that we know that we can do is when an individual tries to get insurance through MNSure, it is nothing but a hassle. So why not let that individual or that small business, that farmer, why not let them go directly to that insurance agent rather than have to go through MNSure and wonder if they ever even got coverage. We could do that. We could make exceptions and make that work. For those that need medical assistance, why not, instead of having them go through MNSure and wonder if they'll ever get it, why not let them go directly through the counties like they always did it before and knew they had what they wanted, knew that they were going to get what they thought they were going to get. And I want to make one more comment too about the MNSure board if we're going to try to make this more efficient. From the very beginning, we said on that board we should have people that knew something about health insurance, because that's what we're offering. And we wanted people that knew something about hospitals and medical, providing medical through doctors and all the people involved. But some of those main players, they refused to even have one voice on that board. And so when we're talking about efficiencies, how do you know what's an efficiency for a health insurance company, for a hospital, for a doctor, unless you actually listen to them? And so it's time to listen, and we can get better if we'll just listen.
Well, good morning. I'm State Senator Julie Rosen from Southern Minnesota. And I also was here 3.5 years ago at the press conference working side by side with Senator Lori and the rest of the House to make sure that MNSure is going to work. And you know what? They did not take one amendment from us, one example of what we needed to support this bill, because we knew it was going to be a royal failure, because you cannot sustain this type of insurance in the marketplace at all. And so now we have something that's cost millions of dollars. You have no choice on your doctor. You have delayed cancer treatments. And I even had a constituent who died because of MNSure down in Jackson. And that's very emotional for me. So I think it's very disingenuous of the governor, from the Department of Commerce, from Take Action Minnesota and the Democrats for saying it's only 5% that's going to be affected. Well, come on out to my district. That is the 5%, as Senator Gazelka said. That is the farmers, the small business owners. And I have MNSure and their helpline on speed dial right now. That seems like it is at a crisis level. And when you go talk to your counties and what they've had to do to ramp up, to even do MNSure enrollment, it's all by hand, folks, still. It's all workarounds. There is nothing efficient about it. And what's so maddening about this, and as you can tell, I'm pretty mad, is that we had the best healthcare system in the nation. And now look what we have. We have people that are struggling and don't know how. They are absolutely crying for help. So again, Governor, come on out to my district. Commissioner Rothman, come on out and see what's really going on, because apparently you are clueless.
I want to thank my colleagues who've all been here for at least a couple of years and are experienced. People have had experience either in the private sector or certainly in the legislature on working and thinking about these ideas. I can tell you, and I'm sure my colleagues would agree, that there is no issue that I hear more about at the doors when we're door knocking and in our legislative offices than the issue of health care. People who say literally, I don't know what to do. I've lost my coverage. I can't afford it. What are my options? The MNSure exchange doesn't work. We hear these things constantly. And the Democrats have no solutions. They have no solutions. This was a very, very partisan, ideologically driven structure that was put in place 3.5, 4 years ago. They did not want any Republican ideas. They had it all figured out. I think it's clear to the people of this state it hasn't worked. It has devastated our marketplace. We've got to restore it, and you can't trust the people who broke it to fix it. But you can trust the people who had good ideas 4 years ago and have good ideas today, and we will fix it. Happy to take any questions.
This option here about letting agricultural cooperatives, fraternal organizations, etc., clubs form their own pools, has that been done anywhere else, or is this? Can you talk a little bit about what they did and how you want to?
Go ahead and show them.
Well, thank you. There are a few places that it's been done, but frankly, the point is, nobody's talked about alternatives for 4 years. We're bringing up real solutions that can be discussed and vetted publicly. Every other opportunity we've had to bring forward an idea has been voted down on party line votes. It's time for us to bring good ideas to the light of day, to put them through the rigorous legislative process, to see if stakeholders will embrace the idea of co-ops, the Farmers Union, Farm Bureau, maybe the Knights of Columbus forming their own insurance group. Let's have a conversation at the legislature instead of just taking marching orders from Washington. That's what these ideas are about. People in Minnesota coming to the legislature, talking about how this impacts them, legislators bringing forward ideas and getting to real solutions. We could probably even attract some Democratic votes on these things because we're going to listen to what matters to Minnesota. We're going to listen to the 5% who've been ignored by this administration. We're going to listen to the people who have to empty their pocketbooks every month in order to pay their insurance premiums. These ideas are put forward with honesty and integrity in the hope that a transparent, attentive legislature will do what Minnesota wants instead of being loyal to Washington, D.C., which is what's been happening with healthcare in Minnesota.
And is there anything that could?
There's one thing. And there was a national idea about association plans, which frankly I had concerns about because of the coverages and so on. Well, we're in enough trouble now that all these options make sense. And if the Farm Bureau members wanted to set up their own plan, this would let them do that. Right now, they have to just go to the regular carriers. Senator Gazelka is in.
Well, I just want to make one comment about that too, because our ideas are really coming from out in the marketplace, people talking to us. And I had a co-op group that said, why cannot we put together a plan? And yeah, we might not have to get waivers to do it, but why not at least think about what could be?
Yeah, is there anything, I'm sorry I came up late, but is there anything that can be done ahead of this present enrollment period, or are those people pretty much just stuck with the
Well,
situation that they're in?
we can't do anything until and unless we get a majority of the legislature that's willing to make some changes. And as I said, we are willing to do that. We've been willing all along this whole discussion to try to solve what is essentially an economic problem. This is not should not be a political football. This should be something based on the economics of what insurance does and how it works. And all the things that we're talking about, these things that are in our release, these are ideas that work, that have worked, that can work. And what we're trying to do is do something that is practical, that will solve the problems of the people across the state, the problems that we are hearing about every day.
But is there anything within the executive authority right now that they could do to kind of at least ease the?
As far as the governor, you should ask him.
I have some advice for the governor. Allow the agents to deal with MNSure directly, not have to sit on the phone. They sit on the phone for 45 minutes to find out that they cannot, they haven't got that kind of time. We've been begging for a portal. They could do that at MNSure without any problem. I question that this quota is even legal. And some of the plans are going to cherry pick. They're going to pick the low-risk people. The entire function of, the whole beauty of the Affordable Care Act, which by the way also was a one-party thing. They couldn't get Olympia Snow to vote for the thing from Maine, which tells you where it stands. I mean, holy cow. But so, I had a great point for me, stupid.
Universal coverage.
Oh, I'm sorry. But the quotas. It was no pre-existing conditions. That was the big deal. That's where the money is. That's where MNSure went. And so now, if a plan is allowed in Minnesota to cherry pick, everybody better worry about that, because if you could possibly be sick, you're not going to be one of the people on the Titanic with those 1,700 or 2,000 or 8,000 policies. You'll be stuck with what's left. And that group is going to have the death spiral. So this is what Senator Gazelka was talking about. We begged in the process. Please have people with expertise on the board. Please have people who know insurance, who know business, and who set this thing up, and it did not work out that way.
Go ahead.
Something that can be done right now, the legislature passed a provision where you could get your tax credits without having to go through the headache that is MNSure. The Department of Commerce has slow-walked that provision. Over and over and over again, we have asked them, where's the authority to do this? So that agents and brokers could have access to customers, help them with their advanced premium tax credits, and not have to go through the headache of MNSure. So Commissioner Rothman could get the 2 people that we paid for. We paid for 2 FTEs for 2 years, and we have gotten nothing. So if you want something that can be done right now, Commissioner Rothman can expedite having advanced premium tax credits handled by agents and brokers. The authority already exists. The people have already been paid for. It is simply a lack of will in the Department of Commerce that is holding that back. And at the very least, there would be some relief for a small portion of Minnesotans.
Any other questions? Any other questions? Thank you.
Thank you.